a second. Here we go. We're live now. All right, guys. I got Dr. Chris back on the live today talking about all the popular peptide hormone TRT stuff. So if you guys got a question about this, feel free to ask. Also, any health related, body composition related, anything a doctor might know, I guess. But Chris, I have a question for you to start with. Somebody sent me a question on Instagram about TRT, and I found it very strange. They said they had been on it for 5 years, taking 100 milligrams a week.
Mm-hmm.
And they said they got blood clots, went in the hospital, and they said, word for word, they said they almost died. Now, and his testosterone level was 2,600 nanograms. Does that make any sense to you?
On 100 a week of injectable testosterone,
Right.
2,600 would be, even as a peak level, would be pretty unexpected. So not really. Blood clots can happen to people. Blood clots are a risk of testosterone. Like, it's, if you go in and get put on TRT, that's one thing your doctor will warn you about in the what's called informed consent process. So, and there is some evidence that testosterone does slightly increase people's risk for blood clots. I think when you look at all the evidence in total, it's a similar situation with women and estrogen. Like postmenopausal women who are put on oral estradiol, especially, they have an increased risk of blood clots, usually within the first year of treatment, and then their risk goes back down to baseline. So 5 years of being on TRT and getting a blood clot, I don't know that you can really blame the TRT necessarily. I mean, people will get blood clots. It happens.
Isn't it kind of weird that his level was that high? Is that even possible? 2,600? Isn't that like steroid use, like bodybuilder levels?
Yeah, it is weird that it's that high. There's not a lot of, 2,600. The thing you can compare it to, there's a study where they gave healthy men 600 milligrams of testosterone enanthate, and their peak levels were 2,800 to like 3,400. That was their peak levels, was 600 milligrams. So yeah, getting a peak level above 2,000 with 100 is no, I don't think that's likely.
Yeah, that sounded a little weird to me.
Yeah, I don't think
that
that's likely.
That was very confusing to me. Sometimes I think maybe sometimes people just get the measurements wrong and the dosage wrong. Maybe they think
a
like
lot of lay people care too much about their labs. I mean, that's what you have a doctor for. Unfortunately, a lot of the TRT clinics are shitty and they don't really understand the labs very well either. So, but yeah, that's what I compare it to most. Healthy men given 600 of Test-E. The highest peak level that they recorded, I think, was like 3,200. That's the peak level. That's the highest.
Yeah,
so for people to get those levels at so-called TRT doses, you wouldn't really usually expect that.
There's something going on there.
Yeah.
Now, what about this? I've heard, chemically induced overconfidence. I heard having higher levels of testosterone can make you more confident. Is that true?
Make you more confident?
Yeah. Unless it's like placebo or something.
It's most likely placebo. The way hormones make people feel, this is one thing that's tough for people to understand, but your hormones don't make you feel any particular type of way. They don't make you have specific kinds of moods. Hormones don't work like that. Hormones provoke physiologic responses that your brain can then interpret according to your history and your beliefs and your life experience. and that can lead you to have, spurt certain types of moods. So like, for example, adrenaline makes your heart rate increase. Well, we all know people that get panic attacks when they feel like their heart is racing, right? But then there are other people that when they feel their heart racing, that's like, it gives them euphoria. Those are the people that jump out of planes. They call them adrenaline junkies.
Mm-hmm.
So it's not so simple to say that hormones cause certain moods or certain feelings. I don't think it makes, does it make you more confident? You build more muscle, then you're just naturally more competent because your body looks better. Maybe there's something to that, but it's not like high doses of testosterone universally make men more confident or more competent. That sounds like a myth.
Roid rage?
Not with TRT doses of testosterone. I mean, certain synthetic androgens can cause a lot of mood lability. So mood lability would just be like you can switch moods very rapidly. And I shouldn't say cause, because I just got through saying the hormones don't cause feelings. Let's just say they're associated with mood lability. No, I think it's mostly a myth, but then again, everybody knows some people that take high doses of tren or whatever that can be very labile. So yeah, it probably is the case that some synthetic androgens make you more likely to be aggressive, but TRT doses of testosterone typically, I think, make people actually more calm, believe it or not, less angry. Having low testosterone levels is also associated with mood lability.
Yeah, because you're acting like a bitch.
Yeah, I mean, it actually has a lot to do with your estrogen levels in the brain too. Because if your testosterone level's low, that means your estradiol signaling in the brain is abnormal. A lot of testosterone's effects are through estradiol in the brain. So that may just be the reason. There's lots of studies in women as they approach menopause. In menopause, women's estradiol levels essentially plummet, right? But as they approach menopause, they get to perimenopause, they get levels of estradiol that go up and down, like they roller coaster to extreme degrees. And that causes a lot of mood lability. But it's not so much that the estradiol's high and then they're moody, and then it's low and then they're depressed or whatever. It's more just, having levels go up and down is your brain doesn't like that. That's why a lot of women in late perimenopause actually get put on estradiol early. And it's actually one of the reasons to put a woman on estradiol before menopause if she has brain fog, cognitive symptoms that could be related to that. And so I think it's a similar case probably with men, believe it or not.
What about this? I mean, I think we know this. Are there side effects? Oh, yeah, of course there's side effects. Are there side effects, or is your body unable to produce testosterone in the future? Those are two different questions. But we know that there is a chance that if you take TRT, your body will not be able to produce its own in the future. Is that more common than not? So if you do TRT, you're pretty much stuck with it?
No, I mean, there are men who go on TRT for a few years, then have changes in their like family planning goals and want to have kids. And oftentimes if they go off the TRT, they can regain their fertility. It just can take a long time to do it. I mean, about 2/3 of men on injectable testosterone at an average TRT dose will have sperm counts of 0 after 6 months of treatment.
Ooh.
And the remaining third, their sperm counts are usually significantly reduced, but they're not 0. So
are there some that have no effect on sperm count?
I've seen it have minimal. If I've seen men on TRT for long periods of time have normal sperm counts, but whether, they had higher ones before, there's a very small minority, their sperm counts are normal, or it's way more common to see either complete infertility, what's called azoospermia, which would be basically a sperm count of 0. But you also see it like at least moderately low. So 5 to 10 million viable sperm per ml, that'd be moderate. Severe would be less than 5 million. And then completely infertile is like 0. So usually you see some degree of decrease. There's that rare person that it doesn't decrease too much. You can see preserved sperm counts if you take HCG with injectable testosterone, and you can see preserved sperm counts if you use nasal testosterone. Nasal testosterone doesn't affect your fertility nearly as much as the others.
Let's see. What's the safest hormone to increase through peptides that would help with muscle growth? Now, I've been hearing a lot about Sermorelin, stimulating the pituitary gland to increase growth hormone, which they claim to have an effect on your ability to build muscle. Would you say, what do you think is better? Like
Yeah,
increasing
so
your
I mean,
testosterone or growth?
I don't think people will be happy to hear this, but most of the research peptides that are sold don't really have body composition effects, at least insofar as like the studies that have been done. The only 2 that are popularly sold that had any body composition effects are the 2 that are FDA approved, which is Sermorelin and Testosterone. So Sermorelin in studies from the late 90s and early 2000s was shown to very, very mildly increase lean mass and decrease visceral fat. Some studies actually showed no change in anything. There's only like 2 or 3. So I think there was one study that showed no effect. That was in elderly men. And then there was another study that showed very mild effects. Testosterone is a little bit more effective. Not at increasing muscle mass actually, but at decreasing visceral fat. So visceral fat is the important thing to decrease, actually. That's the thing that keeps you alive longest, since visceral fat is the inflammatory fat that causes like diabetes and heart disease and cancer, because it secretes inflammatory adipose cytokines directly into the portal circulation of the liver. So testosterone does work to reduce visceral fat. And it probably reduces visceral fat faster than testosterone does. The issue with testosterone is all the studies that have been done show that once patients stop it, you usually regain all their visceral fat that they've lost.
Oh, God.
But you have to contextualize that, because a lot of the patients in those studies were chronically ill. Like, they weren't relatively healthy guys who were a little overweight and on TRT. Most of the studies actually were done in HIV positive older patients. So it could be the case that testosterone, and then to a patient that eventually is on TRT, like, they may preserve some of the visceral fat losses. But so far, all we can say for sure is it seems to work, but it also seems to have a rebound effect. As far as the other ones like ipamorelin, CJC 1295, TB 500, there's like almost no studies. The few that have been done, like for example, for CJC 1295, it showed that it could increase GH and IGF-1 levels, but they didn't even measure body composition endpoints in that study. And the same with ipamorelin. They tested it in patients in the hospital who had bowel resections, and it apparently did nothing for whatever endpoint they measured, but they didn't collect any body composition endpoints. So yeah, there's like no evidence that they work. The thing I say to a lot of people, because there are a lot of supplements that can increase your testosterone level, and clomiphene can increase your testosterone level, HCG can increase your testosterone level. The problem with all those things is even just numerically increasing your testosterone level doesn't result in body composition changes in the vast majority of those studies. So guys will have increased testosterone levels, but their body composition is not really changed.
Mm-hmm.
So why would that be? I think I know the reason why, but before I tell you what I think the reason is, I think the same phenomenon you can see with a lot of GH secretagogues. Sure, you can increase IGF-1. Sure, you can increase GH. That doesn't mean it's going to do anything. I mean, that's for a lot of people, they don't understand why that would be, but we consistently see that with testosterone, for example. Like IGF-1, for example, right? They've done studies on IGF-1 and IGF-1 LR3. There's not a single study showing IGF-1 in a randomized placebo-controlled trial affects body composition. Doesn't decrease fat mass, doesn't increase muscle mass. People are like, well, wait, IGF-1 is when I take growth hormone, that makes my IGF-1 levels go up. Doesn't that mean my muscle mass goes up as well? Yeah, when you take growth hormone. When you take CJC 1295, there's no evidence that despite increases that it does anything. And even if you take just regular IGF-1, it also doesn't change your body composition. So that's really hard for a lot of people to understand. In the case of testosterone, I think the reason why exogenous testosterone, pellets, injections, compounded creams, why do those change body composition so effectively? Well, it's actually kind of counterintuitive, and I don't have proof of this. This is just my hypothesis. Is actually it's beneficial that it shuts down your endogenous system, because testosterone is very energetically expensive to make. So when you just give yourself free testosterone, you're not giving yourself free testosterone, but basically you are. If you inject it, you're giving it in an ester, and as it's metabolized into free testosterone, you're essentially giving yourself a chemical that your body makes at great energetic expense, but you're giving it to yourself for free. So I think a lot of the benefits of testosterone on body composition come from the fact that your body conserves a great deal of energy. Not only do you not have to directly make the testosterone, but all the feedback loops, which also require a lot of energy. Like there's a lot of energy to make LH and FSH and GnRH, all those things. The endocrine system and endocrine glands have tons of mitochondria. They're one of the most mitochondrial dense tissues in the human body. So that should tell you right there, it's very energy intensive to tightly regulate your testosterone levels. And so shutting that system down and giving it to yourself for free, you get bioenergetic benefits from it. And that's what I think is the reason. So in other words, it's not just, it makes my testosterone levels go from 200 to 800 and my muscle mass increases. There's much more going on in the background. And that has to be the case because, like I said, there's many things that can increase your serum testosterone levels, but almost nothing that increases your muscle mass other than testosterone or synthetic derivatives thereof.
So, like, if you were taking some of those peptides that stimulate an increase in growth hormone, you're actually stimulating your pituitary gland, which is probably causing your body to have to use more energy to make more of it, right? It would be like a very
in a way, that's the same thing that happens with enclomiphene. You have to produce all of the hormone yourself. I mean, you're not, you know what I mean? You're just instructing your body to make more of it. But it's not actually conserving energy. It's not becoming more bioenergetically efficient. In a way, it's becoming less efficient. So this is another caution to people, like the research peptides. There's a reason why the pharmaceutical industry didn't develop any of these things. It's because the early studies showed they hardly did shit. And the same goes with BPC 157 that everybody thinks is like this miracle healing drug. Unless you can compare something to a placebo with enough patients to adequately power the study to look at outcomes on body composition, it should just be assumed that it doesn't do anything, because the vast majority of drugs that go into development or pre-development, they end up, being disappointments, So the peptide thing is just interesting. Like, the use of them has exploded since the pandemic. And I think a lot of unscrupulous, very minimally educated, and certainly unqualified people sell these drugs saying, look, it raises your IGF-1 level, or look, it raises your testosterone level. This is natural. This is better than what you can get at the doctor. And the average person doesn't realize a lot of this stuff has been tested and found wanting, which is why, if it really did what these people claim that it did, they'd be multi-billion-dollar pharmaceutical drugs, just like semaglutide, tirzepatide. Those are peptides, but they work. They work very well. That's why Eli Lilly makes billions of dollars a year. I mean, they pay to develop this and put this through FDA testing. It's not the FDA is, they're so reputable and there's no corruption. Sure, there's lots of corruption. But the issue is pharmaceutical companies still have to prove effectiveness. They not only have to prove that the drug is safe, like there's no obvious safety issues, they also have to prove that it's effective. So like enclomiphene, for example, was not FDA approved for hypogonadism. Why? Was it because it was unsafe? No, it was because in the trials that they did, yes, people's testosterone level went up, but they didn't get any symptomatic benefits. Their body composition didn't change. It was a total disappointment.
But they still sell it.
But they still sell it. And they still can sell it, but they can't sell it in commercial pharmacies. So there's no brand name enclomiphene that you can get. You have to get it compounded, yeah. So yeah, I mean, people are just there's lots of terrible information about this stuff out there. That's not to mention the fact a lot of these peptides come not from pharmacies; they come from research chemical. Who knows how they're making these things? Who knows what adulterants are in them? That's why I caution people with the retatrutide thing. You got to be careful about what's in it.
I know.
Depending
I
on
know
the source.
people who own a compounding pharmacy down here, making all the peptides and semaglutide and stuff. To me, it just seems like, it like upsells the tirzepatide and semaglutide and stuff. It's like, okay, well, you can take this. That's going to help you lose weight, but you're going to want to take this. You can also build muscle. So now instead of spending $300 a month, they're spending $600 a month, and they just increase their monthly spend.
Yeah, and this is the TRT clinics, what they do. This is their specialty.
Yep.
I saw a guy this morning right before we got on this live who came to me. He's been to a variety of different TRT clinics, and everywhere he goes, he gets put on one more stupid peptide. He's on IGF-1 LR3, he's on tesamorelin, he's on DHEA plus pregnenolone, and what was the other thing he was on? He's on testosterone, which they couldn't figure out how to dose it or control any of his side effects. So they just add a bunch of, he's on an anastrozole too, which is another bad drug. As a side note, a lot of people don't realize GH secretagogues in clinical studies have actually been shown their effects are ablated by aromatase inhibitors. So if you take aromasin or anastrozole, like ipamorelin doesn't do shit. It completely ablates the effects that that ipamorelin has on the on sensitizing the pituitary cells and the hypothalamus. So it's completely worthless drug to take if you take anastrozole. That's just as a side note. It may be worthless even without anastrozole, but and there are studies on that. So yeah, but these TRT clinics are just there's a lot of really unethical practice, and but the other main problem is there's a lot of providers that own and run them that really have no business owning and running a clinic of any kind.
It's just like a cash grab, it seems.
It is
They
a
might be
cash
around for a
grab.
couple of years. People start to realize that most of it's bullshit, and
Mhm.
then on to the next thing. It's probably just like a fad.
Well, they are very popular, so people make a boatload of money. A lot of these, like, they even have multiple locations and stuff. So they have a lot of money behind it. People are just unsatisfied with like going to their primary care doctor.
Mhm.
And so they, go to a TRT clinic, but TRT clinics are, I mean, 95% of it's not all of them, but they're quite bad. Which is also why there's some research showing they lose like 30% of their patients a year. Sometimes a lot more than that.
Huge turnover.
Like my clinic, for example, I don't call myself a TRT clinic, but we obviously approach things differently. We have a near 100% retention rate. We've lost one patient in about 2 years of operation, just a single one. And 30% of our patients are doctors, MDs. So I'm a doctor's doctor. I see a lot of doctors that want to be on testosterone or, want like expert care in the area of medical body recomposition. So I see a lot of healthcare providers and especially a lot of doctors. I can guarantee you the vast majority of physicians would never go to 99% of so-called TRT clinics because they know the providers there are unethical. And even if they're not unethical, they're unqualified. It's a revolving door. So a lot of them have also milked the insurance companies too, because if they can get people to qualify for testosterone, then they just bill insurance. And so they get 40, 50 patients a day in there. You can't, as a healthcare provider, see 50 patients a day and safely take care of them. But that's what happens at a lot of brick and mortar TRT clinics. That's what happens with a lot of online clinics too. They're like half-hour, 15-minute appointments. And it can be appropriate to see someone for that short a period of time if you're like know them a long time and you're just following up with them. But me, the new patients, I spend an hour, hour and a half with them. And we look at their body composition and we look at all their labs. And I hear what's important to you. And we talk about the risks. We talk about the unknown risks. So this stuff doesn't happen in a 5 to 10 minute, meeting with a PA at some big box TRT clinic.
Yeah.
It's more like, hey, Bob, how you doing? I'm okay. Oh, your sex drive good? Yep. All right. Well, here's some testosterone. Take this bullshit supplement. Here's a bunch of other supplements. Here's another injection we can give you. Here's a troche version of Cialis that costs 20 times more than what you can buy it for off the $10 menu at Walmart. It's a bunch of bullshit. It's the guys in this country are just getting fleeced by these TRT clinics. It's sad. But I think also sad for some of the, clinic owners who are maybe not as unethical is there is a better way to do things. There are a lot of men that need testosterone that are not on it and are never going to get it from their primary care doctor for a variety of reasons. And so, actually having educated healthcare providers can go a long way to fixing the epidemic we have of metabolic syndrome in this country, because testosterone improves metabolic syndrome significantly and with minimal risk in middle-aged men without certain risk factors. But the providers at the TRT clinics don't know that. They don't understand that. Everything's just based on a protocol, because when you see 40 patients a day, you have to do things algorithmically. You can't deal with people individually because you don't have time. You have to, okay, what is his what's his level? How does he rate how he feels on a scale of 1 to 10? And then we adjust the dose here, give him an estrogen blocking drug here. I mean, this is all just disastrous. The thing I worry about most is because they do such a bad job at most TRT clinics. They give the rest of us involved in testosterone a really bad name and a really bad reputation. They lump all of us together. And that's why I constantly try to differentiate myself from other so-called TRT clinics. I mean, I just, I treat metabolic syndrome. I'm not really a TRT clinic. But anyway, I didn't mean to go off on that monologue. I'm sure there are other questions.
Well, I just found one from the email you sent me. So, guys, just so you know, I've got this list of questions that I'm going to be dipping into as well. And
those are from our live stream. Those are from our social media. She compiles them together.
Okay.
Yeah, I mean, some of them are probably going to be stupid, but
well, I'm skipping the stupid one unless it's really stupid and it's funny.
Yeah.
How do you prevent your testosterone from crashing if you take a 2-week trip when TSA might confiscate what you've got? Yeah, I always wondered that. If you're taking a trip overseas or something, doing your TRT, how do you travel with it safely?
You bring it with
your prescription. You bring that with you, right? But
yeah, you have the label, so it's prescribed by a doctor, so you shouldn't have any problem.
What about like
bring it with.
syringes? They don't care about that, right?
Yeah, but you check those because you can't bring needles probably on the plane.
Okay.
It's not a problem as long as you have a label for everything. There are some like Middle Eastern countries that have weird laws and stuff related to various drugs. I mean, they're not looking really for testosterone for medical purposes, though. Like you don't want to be caught with cannabis in Singapore, for example, because you'll go to prison. You might even get the death penalty. I don't know if they give you the death penalty for that, but there are some really harsh laws related to drug use. But if it's a prescription drug with a label that's prescribed to you from a doctor, there's not going to be issues mostly.
Mm-hmm.
But just check it in your luggage, and TSA the people that look at your luggage the most are is on the American side, right? I go through Monterrey, Mexico, the security there, it moves at lightning speed because they don't look at shit. You just put, it's just like going through the motions type of thing. The line moves like extremely fast. You put everything on a conveyor belt. You don't take off your shoes. They don't do body scans. You just walk through like a 1970s style metal detector, and that's it. People aren't going to have a problem usually checking it as long as you have the label on it.
Here's one. The best way, man, hopefully you probably didn't enter this on your page. Best way to lift weights to maximize gains from TRT. High intensity
That'd
training.
be a good question for you.
Yeah.
The best way to lift weights is probably just the best way to lift weights, period. I don't think TRT makes it any different than non-TRT person.
People think that TRT is going to substantially increase your recovery ability. And to be perfectly honest, since I've been taking it, I've noticed no improvement. I still need several days to recover.
Yeah.
So do you think, my gut tells me it's really not going to do all that much. Maybe if you're training the shitty way most people train, you might have a little more energy, you might recover. It's probably mostly placebo, but the only thing, after talking to professional bodybuilders, for instance, Dorian Yates.
Yeah, that's what I was thinking of.
In other professional bodybuilders, they said what made the biggest difference in recovering from workouts was growth hormone. And I think
that makes sense.
Like from what I heard, I was talking to a colleague of mine, and he was telling me about a professional bodybuilder he was speaking to. And he was saying, like, they almost can't overtrain. Like, they could train in the morning and then go back in the evening and still have the same intensity. And it seems to be coming from the growth hormone, not even the synthetic TRT derivatives or DHT or any of that doesn't seem to affect it. But once these guys get on the growth hormone, completely different ball game. And what I heard is what he said was they can tolerate so much training that they end up beating the shit out of their joints in the process and injuring themselves because they can tolerate it, but their joints can't tolerate it. And he says there's a lot of guys who would be very prolific bodybuilders that end up hurting themselves in the process and don't make it there because they do so much because the growth hormone just makes it like impossible to overtrain.
No,
And I
look at
think,
what Ronnie Coleman did to his body.
yeah, that's true. Yeah.
I mean, he's in a wheelchair.
Yeah, from
Yeah,
squatting.
being on like 10 of growth and a bunch of anadrol and tren and 1.5 grams of tests a week. Yeah, I'm sure they recover a lot faster than normal people.
Now,
sure.
okay, say you were taking all that. What are the downstream health implications that someone should worry about? Say they're a bodybuilder. I was actually talking to a young guy who is a natural bodybuilder, and eventually he wants to move into the, enhanced so that way he could compete at a higher level.
Mm-hmm.
So I'm wondering, like, what even are the long-term health complications if you're doing something like a bunch of growth hormone, then all those oral compounds and tons of testosterone? What could they potentially expect?
Your heart and blood vessels. You cause damage to your heart. People who use synthetic androgens and growth hormone, it's rare you just use growth hormone and no, steroids themselves. Yeah. The biggest risk is that you develop issues with your heart or you develop vascular problems. So a lot of those guys get heart failure. They have strokes. Though they can definitely have blood clots. They can have arrhythmias. I've actually talked about there's studies showing that I can't remember the exact duration of use, but there was a study in the European Journal of Cardiology in December 2023 that showed something like after 5 to 7 years of even intermittent synthetic androgen use, 50% of current and former users developed problems with their left ventricular ejection fraction, and 10% of them had diagnosable heart failure. So the androgens definitely over time cause damage to your heart. And that's the biggest problem. So that's why I tell the guys that are bodybuilders, you need to make sure your blood pressure is normal. You need to make sure your LDL is very suppressed. That's your bad cholesterol, or the cholesterol that causes coronary artery disease. There's some risk reduction things you can do, but nothing to completely get rid of the risk. But yeah, those are the biggest problems.
I have a question. It just popped in my head because I'm curious. Why is tren so effective? Why is it so much more effective than all the other synthetic androgens? Do you know?
In terms of just like its anabolic effects?
Yeah. Because it's got like an anabolic, it's like, isn't it like 5 times more anabolic than testosterone?
Yeah, I mean, it's
5
more
times more
anabolic
androgen.
than pretty much everything. It it was used to beef up feed cattle like bulls and stuff.
Mm-hmm.
So yeah, it's just way more potent. That's really the answer.
Is it like the chemical structure or something that makes it that way? I mean,
Ultimately, yeah, it's the chemical structure.
mm-hmm.
It's way better at promoting those anabolic pathways. The problem is that because it was never designed for human use, it has all these alien metabolites too.
Mm-hmm.
Some of those are probably anabolic as well, but they also, cause various other issues and problems.
Now,
So
what
yeah.
I was I was talking to someone about 3 weeks ago who was experimenting with tren. And the funny thing is, you would never know that they were taking like, but they said they had
Yeah,
to
I mean,
stop
that
because
happens.
the night sweats. They would wake
Mhm.
up drenched. What the hell causes that?
The other hormonal issues that cause a lot of progestogenic effects
Okay.
and estradiol effects. So we don't really know exactly what causes like night sweats when you take certain not poorly studied or minimally studied synthetic androgens, but invariably it's just the metabolites they have cause issues with progesterone primarily or estrogenic, you know. So that's a super common complaint that people have.
What about, oh, here's another question. I have a friend. It's so
I don't
funny
know if
because
that's a satisfying answer.
down here in Florida, it's just like all these peptides, like it's just wild down here. So a friend of mine started taking L-carnitine, he said, for fat loss. He says it speeds up
Mhm.
fat loss. And I tried to explain to him fat loss is a result of thermodynamics, like an energy balance.
Yeah.
And he was convinced that he was losing fat taking L-carnitine. And I said, well, is your weight going down? Well, no, but I could just tell, like, I'm losing fat. I'm like, that makes no
Or is
fucking
his
sense.
fat mass going down? Yeah.
So,
L-carnitine has been shown to help with patients who have metabolic syndrome. So they have inflammatory obesity. So they're
visceral,
what's that?
visceral fat reduction.
Well, they have a lot of visceral fat, but even their subcutaneous fat, they have insulin resistance. So um, what happens in your liver, your periportal hepatocytes, in your skeletal muscle, and eventually in your fat cells itself is they become insulin resistant and they develop what's called metabolic inflexibility. So they can't switch from combusting glucose to um, fatty acid metabolism, and so that causes like a traffic jam in their mitochondria. It's a very maybe overly simplistic way to describe it, but they can't just completely metabolize substrates. And so what L-carnitine does, it helps with fatty acid beta oxidation and transport and makes it more efficient. And there are studies showing that L-carnitine in metabolic syndrome reduces like inflammatory markers like C-reactive protein and stuff like that. So there are studies that show that it's beneficial for that. In terms of like fat loss, um, I don't know that it'll cause you to lose more weight per se, but definitely in patients who are metabolically deranged, it can help reduce the inflammatory component of obesity, or at least it looks like that. So
Wow.
that's what I put people on L-carnitine for is metabolic syndrome.
With
As a weight loss
testosterone?
drug, it's what's that?
You put it on with testosterone?
Yeah,
So it
and
will,
some.
so testosterone alone doesn't have as good of an effect as when you add this.
No, like I said, it's just for patients who have elevated like CRP
Mm-hmm.
and other, that shows they have a lot of just chronic inflammation. Because what happens when your fat cells are metabolically inflexible is this also happens in your testes. That's why really fat guys get hypogonadism too, because your testes rely on fatty acid oxidation more so than most other tissues. But what happens is if you can't completely oxidize fatty acids, some of those byproducts accumulate inside the cell and they're very toxic and they can cause inflammatory reactions locally, which can then cause them systemically. So I forgot what the question was, but that's kind of what the L-carnitine is to help with. I mean, testosterone helps with all that stuff too. Ultimately, I think anything that works in the realm of metabolic disease. If it works, it's because of its effect on making mitochondria more efficient. And so that's what L-carnitine can do, but it's not for everybody. And it's
But you
not a
can do
weight
that
loss
through
drug.
exercise, couldn't you?
Yeah, of course you can. You can do that through just fasting.
Well,
Yep.
there you go. So everybody's, you know.
Yeah.
Oh, wait.
And that's why really fat people with metabolic syndrome, fasting is helpful, because if they, you have your body can't, your mitochondria can't efficiently process fats, sugars, amino acids. So you starve them of those substrates. It kind of clears. It's kind of like a busy intersection where there's like a car crash in the middle of the intersection, like it's rush hour and there's a million cars building up. Well, if you just block the roads on every side and remove everything, that's in the middle of the intersection. It's maybe a bad example, but you get the picture, right?
Yeah, just allow less cars to enter.
Yeah,
And then
yeah.
the building will clear out.
That's kind of
Yeah.
the that's kind of what it is. That's also what I was explaining. This is at the heart of why people don't, I think, understand obesity that well. Because obesity, we think, is just a calories in, calories out type of thing. And in a sense it is. But it gives you the false impression that obesity is a condition of energy excess, when really it's a condition of energy inefficiency, and especially when you become insulin resistant early on in it, when you are developing metabolic syndrome, you're not insulin resistant in your fat cells. That's why everything gets stored there. Eventually you do become insulin resistant in your fat cells. You can't store it anywhere, so you develop what's called ectopic fat deposition and glucotoxicity. So it deposits in the parenchyma of your organs. And that's no good. If that happens, that causes all kinds of inflammation as well. So, yeah, I mean, it's just, this is just like we're in the process in medicine of transitioning everything from a focus on DNA and calories and surface level stuff to what really matters, which is, mitochondria, how efficient your engines are. Like if you imagine, if you take a Ferrari, a brand new Ferrari, and maybe like what's some shitty, old car, and obviously they have two different engines in them, right? Well, if you put, 10% ethanol gas in the Ferrari, you're not supposed to do that, right? But the Ferrari's still going to run really well. If you do that long enough, I mean, you might damage the engine. But the shitty engine, you could put the best premium gas in it and it's still going to run shitty. So your body's kind of, you know what I mean? Like your body's kind of the same. That's the whole thing with seed oils too. People think seed oils are toxic. Seed oils are toxic only if you have metabolic syndrome and your mitochondria can't process substrates and run your metabolic programs efficiently. But if you have that, I mean, everything's toxic, sugars, But we know metabolically healthy people, they can eat shit on a shingle.
Yeah, like kids.
They don't
They
gain
can
any
eat whatever
weight.
and they don't gain any weight.
Yeah. So I mean, it's an efficiency thing. But people don't realize that yet, unfortunately.
Now, here's a good question. Can you please have the doctor explain that Michael Hearn is in fact 100% natural? And this is the guy we're talking about.
I don't think he's natural. I think is he admit
Exactly.
that
He's been saying his whole life that he is 100% natural. And everybody knows he's full of shit. But looking at him, what do you think this guy's taking? I think he's like in his mid 50s.
No idea. Whatever he's taking works to get his physique like that.
He's
I'm not good
50.
like Derek from More Plates, More Dates, where he like guesses what people are on and stuff.
Mhm.
That's a thing with doctors. Like people often confuse me with someone that knows, oh, well, this amount of Anavar will get you this kind of muscle gain. We have no studies on non-medical use of androgens, almost none. So if everything I do is based on research, which pretty much it is, you know, how would I know? I mean, the people that would know that are the people with the most experience coaching people on using the substances.
Mhm.
Doesn't mean that they're doctors or that it's safe to do, you know, it's not safe, but yeah, I can't really look at someone and say he's on you know, this much trend or he's taking 10 of growth or whatever. Like I'm not um
But
do
he
that.
ain't
He doesn't
natural.
strike, yeah, he doesn't strike me as natural. No, his
Yeah.
physique doesn't look natural. I mean, they're
I
they're
know.
testing drugs that in it that right now are like immunomodulators that can improve muscle tissue by inhibiting or interfering with myostatin.
Oh,
So
yeah, I saw that.
yes, yeah. So I don't know if you've heard about that. There's a lot of you know, those are in the early stages of testing right now. Um, so there are people that are born with certain genetic things, like The Rock, I think, was said to have. He has like a myostatin deficiency, so he can genetically just become huge.
Yep.
You
Eddie
know,
Hall.
right? But there's even just, you know, everybody knows that your genetics affect how well anabolic steroids improve your physique. I mean, that's like so obvious. Even the dumbest person on bodybuilding forums understands that. And there's
Mhm.
people with such shit. Well, I don't want to say shit genetics. Let's just say they don't have the genetic makeup that would allow them to experience the same degree of like physique benefits, right?
Mhm.
So it's just kind of like that, you know. There's the steroids, there's the training, there's the nutrition, and the genetics play a pretty big role, a much bigger role than most people realize. I think, you know, there's some people that no matter how hard they train, no matter how disciplined they are, will never be IFBB pros on a stage, right?
Mhm.
Um, you know, I mean, would you agree with that? I'd say that's,
Yeah,
I
I
mean,
would
most
say
people would agree.
genetics probably play the largest role
Yeah.
when it comes to
Yeah.
becoming
Yeah. Maybe
professional
even the
bodybuilder.
largest role. You're right.
It's gotta be. It's
So,
it's almost like a genetic beauty pageant. I mean, obviously you
you
gotta
know, it is. And I really like bodybuilders and you know, I call them the boys. You know, I have lots of
Mhm.
patients that are bodybuilders that I take care of. And they're, you know, they're generally my type of guys, but it's just a fact. Like even from research, we know a lot of them do have like body dysmorphia. A lot. There's a disproportionate amount of body image issues.
Mhm.
Um, you know, and but we have to acknowledge that that's kind of part of it too. And you know, it even affects guys that use steroids that aren't competitors. You know, like you probably know guys that are like they're huge, they're massive, like they're the 0.1 percenters walking around with the physiques they have, but they say they look at themselves in the mirror and they still seem small or whatever.
Mhm.
Like, you know, it can definitely become a kind of a dark, dangerous path, you know, especially today, especially today, in our
With the
culture, in American
comparisons.
culture today.
Yeah.
Because men today are more obsessed with their physical appearance than they've ever been. You've heard of this whole looks maxing thing, right?
Mhm.
Um, so yeah, man, it's a lot of there's a lot of comorbid psychiatric things that go along with the people that are most likely to take synthetic androgens. Like we also know from studies that 60 to 65%, maybe even higher, have concomitant drug use issues. So they use like cocaine, or stimulants, not like prescribed, but like, illicitly, or they have problems with alcohol. So it's kind of like a risk takers, addictive personality thrown in with some body image issues. These are all things that are in the study, so that it's not, I'm not saying it to denigrate them, because I like these guys, but
It just is what it is.
if you take care of them, you have to realize that some of the issues that go along with it. I mean, that's just the reality.
This
You know what I
one,
mean?
yeah. This one we probably know the answer to. If you could use one SARM or steroid, etc., what would it be? Low dose of test. Well, I guess your goals have to be considered here, right? Like, if I guess from a body composition perspective, I mean, the SARMs don't seem to be as effective as testosterone.
No, and they're toxic too.
But like, if you were talking about, okay, what's the best steroid for body composition, I don't think it would be testosterone. It would probably be
No, but it'd probably be the safest.
right.
Well, not
So
probably. It's definitely the safest. Yeah.
the more effective they are, the more dangerous they are. I mean, that's should be pretty common
Yeah,
knowledge.
probably.
But I would guess, like, yeah, I guess for most people, it'd probably just be testosterone.
Yeah.
Once they start
Yep.
demonizing it, that I heard something really funny the other day. They with the testosterone thing. Like, if you're a woman and you want to change your sex, testosterone is medicine. But if you're a man and you want to improve your testosterone for all the other benefits, it's now drug abuse. It's fucking, it's kind of
Yeah.
ridiculous.
That's because, yes. Yeah, and that's super hypocritical. And obviously, the issue is people, and in our society, there's like this thing where men are not allowed to improve themselves aesthetically, and it be considered medical.
Mhm.
So I've said this many times, like, when a woman goes and gets a deep plane facelift, which I don't know hardly anything about that procedure, so I'm just picking that for example. Some extreme kind of plastic surgery, okay? We're all like, oh, that's medical, but she's doing it for aesthetic purposes, right? Or you get a nose job or whatever. Like, these are pretty invasive things that they do to themselves, right? Why is that okay? But then men using androgens is not okay, assuming they're adults and they understand the risks and everything. They're both kind of aiming for a certain degree of aesthetic improvement. One person's using surgery, the other's using drugs, but somehow the drug side of things is very heavily demonized. Obviously, with the whole gender transformer thing, yeah, that's another area of hypocrisy too. Why is it that, I mean, that's a whole like rabbit hole you can go down. If you're an adult and you want to masculinize yourself, I think you should be allowed to do that. If you're of sound mind and everything. But I also think if you're an adult male with agency, not a 17-year-old high school kid playing football or lifting weights. No one thinks that people like that should be on steroids. So I want to be clear. But if you're a 35-year-old guy, I mean, why shouldn't you have the right to improve your physique through the use of some drugs with medical help and supervision? I don't think that there's anything wrong with that, but society thinks there's something wrong with that.
Just like if you looked at, people who are using Ozempic to lose weight, that could be considered cheating to the same way testosterone would be considered cheating for building muscle. I don't see the difference
Yeah,
between
and that's one of the objections people have, like, oh, well, you're cheating if you use androgens. Well, cheating who? It's not a competition.
right.
Like, who is being cheated?
Yeah,
Right?
that's
It's
true.
a stupid objection. Yeah, obviously, if someone's playing sports or competing and testosterone or any androgen would help them, function better, even if they're doing like rifle shooting, Olympic rifle shooting, and taking beta blockers, to calm them down and keep them steady, that's a form of cheating. But if I just want to shoot my rifle better in my backyard and I take a little propranolol, like who the fuck am I cheating? If I like that's just a very stupid, like, why the people that raise that objection are kind of like the people that are just hyper, like they try to compare themselves to everybody.
That
I
makes
consider
sense.
that a red flag for like a personality disorder type of person, because it's like, why are you he's cheating because he looks that way, but he's not competing with anybody.
Right.
The only competition is the one that you invented in your head.
Actually, it's funny you say that. I stumbled across a Reddit post where they were asking about my approach to training. And one of the comments was, well, once I heard that Jay Vincent was on TRT, um, I stopped following the advice because any training works when you're on TRT.
That's
And
not true.
I was like, yeah, ridiculous. Like, and I think they find that in the fitness industry too.
Mm-hmm.
If you are using testosterone like this, somehow all of your recommendations are invalid now because it makes pretty much anything you do more effective and everything you say is irrelevant now. But
Yeah.
from my experience, it didn't really help all that much, honestly. Like I looked a lot leaner and actually more muscular when I wasn't taking it because less water retention.
Mm-hmm.
But yeah, there seems to be a lot of people who just get their panties in a bunch about TRT as if
Well,
it's
you know me. I'll put it to you this way. I'm the best TRT doctor in the world, I think. People are going to hear that. They're going to think that sounds extremely arrogant. But I think that it's true. And I think when my book is released, it's going to be obvious that my approach to this is superior to everyone else. If I'm not the best, I'm definitely up there. You're the only person that I refer people to in terms of training. I don't trust anybody else. The reason I refer them to you is because I know that you're research and reality based. More important than anything else, reality based. In our society today, we have a huge problem with too much information. Because of all these fucking social media outlets, Instagram, TikTok, whatever, everybody has a platform and everybody has access to everything. And people would say, well, that's good. There's more knowledge out there. No, there's not more knowledge out there. There's more unstructured information out there. Knowledge, wisdom and knowledge come from educated, and not even just educated in the formal sense, but like reasonable interpolation and synthesis of all the data and information that's out there. There's only a small number of people that can, synthesize things into a way that makes sense and comports with reality. So that's why I refer people to you, because I know that, okay, how do we make this more efficient? How do we make someone's regimen more able to, be effective for them? And how does this comport with like the exercise physiology literature? You read journals and stuff.
Mhm.
There's all kinds of people out there that give fitness advice. Never mind that they don't have an education in it. That's in the fitness space. It's not like you need some specific type of degree. But things you do should be evidence based. Like there's an answer. What is it better to do 10 sets with low reps, on this type of exercise versus like, just a single rep to muscle failure and doing it slow, like the mechanics of it. Like there's a way you can test those two things to see what results in greater hypertrophy or whatever. And so because you constantly do that and you're constantly open to changing your mind if you're wrong, that's why I trust you with my patients. I don't trust the average Instagram. Like I would never send somebody to, I saw that alpha male guy, what's his name? The guy that you have to make a certain amount of money to, and he'll train you or something.
Is that what?
I forgot his name. You know what I mean? There's like a million people like that
there's
out
a
there.
bunch of them. Yeah.
Like I never would send someone to people like that because it's just like, especially today's day and age, you have to be maybe not. We have to be research based, but you have to live in reality.
Mhm.
There's a ton of people that live in fantasy. This whole thing with the research peptides is all just fantasy based. Like the BPC 157 is the best example of what I'm talking about. When BPC 157 started being marketed, they said it was a gastric peptide, which that's never actually been proven. And it can heal specific types of like stomach issues. Okay. Now people are claiming, oh, it heals my ligaments. Oh, it helps me sleep deeper. It helped me recover from my rotator cuff injury. You know, it fixed my rheumatoid arthritis, like all this shit. And it's like people don't understand there is something called the placebo effect. And anytime you're dealing with subjective outcomes, like pain levels, for example, there's many studies showing you can give someone a sugar pill, and as long as they think that it's some type of drug that decreases pain, it could be just a sugar pill. There are a lot of people that'll say, man, my pain is 200% better than it was before I started it. You know what I mean?
I think that's how chiropractic care. I believe that
That's how a lot of
chiropractic,
alternative medicine stuff works.
you go in there expecting to feel better. You hear these crackings, these positions, and through the power of suggestion, ooh, doesn't that feel better? Do you feel better now? We're doing this, we're doing that, and then they wake up.
Yeah, I mean,
you're right.
just watch these old preachers that used to be on TV that would make people like pass out.
Mm-hmm.
What was that guy's name? Not Benny Hanna, that's a restaurant. Benny Hinn or something like that. You know, he'd just say a word and you'd like collapse and fits and stuff. This is all like suggestibility.
Yeah.
You know, so the people saying that you're not credible because you're on TRT. First of all success, for virtually every successful man as he gets older is going to be on TRT. I mean, that's just what we all eventually do. Or I shouldn't say every, but you know, the many of them do. Okay, it's not like a poor man's type of thing, right? HRT, like the new thing, people see it as longevity. That you know, there's some issues with that belief, but TRT, being on TRT doesn't negate any of the advice that you have on exercise or your body of work, which I think is proven itself over time, and the number of clients that you've helped and can, you know, testify to I was doing this training regimen and, you know, got on this new one and it's much better. So, you know, but those Reddit guys they don't like me either. I mean, you know, Reddit to me, there are some people on Reddit I'm sure are like regular guys you could have a beer with, but the vast majority, if I hear like some guy is a Redditor, I just immediately think they're just a fucking loser. Like they're just, you know, Reddit to me is like a left-wing echo chamber type of place.
Where people go to
And
bitch.
it's like a very feminine form of social media, I think. So I don't think there are many real like masculine men on Reddit.
No, because who can sit there all day?
You know, I don't want to say everybody's like that, but
I know, but like, yeah, who would take time, like a large amount of time out of their day to do like a long Reddit post. You know what I mean? Like
Yeah,
sometimes
I
I
mean
like to look
it's
up like
girl shit.
yeah. Like sometimes I
It
like to
really
look up
is.
UFO stuff because I think the UFO topic is interesting. And there'll be
Yeah.
these people that write like this 4-page write up, like just trying to disprove something. It's like, don't you have a fucking job?
Yeah, and that's the other thing is, people now more than anything, people really want to be seen and heard.
Mm-hmm.
And
Attention,
that's
yeah.
again just a result of the culture we live in. There's just like a lot of loneliness, and people don't have other people to talk to. And if they do, everybody has such a short attention span, and their brains are their dopamine system is fried by constant, doom scrolling and stuff.
Mm-hmm.
They want to be heard and they want to be seen. The problem is that it's just a fact. Most people really don't need to be heard or seen because most people, and again, this is very harsh, but I'm known for being just telling it how it is. We know just from studies, most people are low IQ. But just most people on the planet are not intelligent. And it's only in modern history that we started to think that everybody has a valid opinion and everybody should be heard. But if you're a fucking idiot, I mean, your opinion should be just totally discarded. And I would say most people on social media probably mimic most people just in the general population. It's not a bell curve. IQ is not a bell curve in that there's really low, average, and then really high. It's more like there's a lot of people that are above average and there's a lot more that are below average, and very few people fall like in the middle. The bell curve shape is really just a result of statistical manipulation. I mean, it's when you really take people at face value and measure their intelligence, most people are stupid. I mean, that doesn't mean they're bad people, but it does mean that we don't need to like listen to you on your TikTok channel give us dating advice when you're just an idiot. Or we don't especially don't need you to give us health advice, you know,
And yeah, that's most of them.
or exercise or any kind of advice for that matter. So that's harsh, but that's really how I feel.
How would you identify? So, say you were like scrolling for advice online. How would you be able to tell if someone was intelligent versus an idiot? What are some things you would look for? This might help people when they're looking for advice on things.
Like in terms of medical advice.
Well, just in terms of advice for anything. Say they wanted advice for exercise or health or dating or marketing or whatever. What are some things you would look for to identify if someone was an idiot or if they were actually intelligent?
Well, let's use like a crude example, okay? I'll bring in our good friend John Anthony. So there's a ton of idiots on social media that proclaim to be dating coaches, right?
Mm-hmm.
Come buy my book, come buy the subscription to listen to my lives where I tell you how to, get on dating apps and text women and whatever, right? There's like hundreds of them. It's impossible to be on any of these apps and not encounter like one of them. Well, like if you're looking to get better with women, don't you want to go to a guy that has slept with a lot of women and has proof of doing so? Like, why would you want to listen to some like neckbeard divorce guy that's writing on a fucking whiteboard, as I have a whiteboard behind me that I never use, with no actual proven results of anything? And I said it's crude because there are a lot of other dating coaches that are super popular, and you look like your girlfriend's like super ugly and she emasculates you on live streams. Like, your life is not the life I want to imitate. You know what I mean? So with something as simple as that, as something as simple as dating is universal to most men. Like, not universal. A lot of men aren't dating, but what I'm saying is, like, most men will want to do that, right? So to me, I just would try to find someone who's successful in that particular area and mirror them. It's kind of like I'm looking for business advice. Am I going to go ask some broke loser, living, right outside the 7-Eleven, sleeping in the parking lot? Or am I going to ask a multimillionaire who built several businesses? So the source matters a lot insofar as like credibility. When it comes to health advice, it's a little bit harder, right? Because anything that's more complex requires more education, requires more expertise. So it's harder to discern the sources, but generally speaking, with most things, if like you're looking to become a better chef, go find someone who knows how to cook really well. And the type of food that they make, you've tried, and it's amazing. It's like simple as that, just because someone says they're an expert in something doesn't mean that they are.
Self-proclaimed. That's what they call that.
Yeah. Yeah.
All right, guys. We're coming up about an hour 15 here. I'm going to try to have Chris on once a week or so. If you guys like this and you have questions throughout the week, jot them down, come hop in, ask your questions. We'll get to as many of them as possible. And we'll try to give you guys some useful information that you can use actually from actual experts to improve.
Yeah.
All right,
Thanks.
Chris. Thanks for coming on.
Appreciate
and follow Chris on TikTok. What's your TikTok name?
C Bronson MD.
At C Bronson MD.
Yep.
Yeah, guys.
And
all right, guys. We'll see you next time.
Thanks
Adios.
a lot. We'll see you.